morning, everybody. How are you today? In Kenya, I would say jumbo. Oh, thank you for that. Okay, so today we're gonna shift gears slightly. We'll start talking about the future of education. We'll be having a panel, but before the panel comes on the floor, on stage, I want to share something about our Kenyan content. My name is Janet Muriuki from IntraHealth International, Kenya office. I think critically for us here is to look at three spheres: health, education, and technology. How do they come together? Over the last couple of years, the ICT sector in Kenya has been rapidly expanding. We've had quite a number of changes because of fiber optic technology and mobile technology. And this technology has been able to serve a large number of Kenyans and resulted in revolutionizing trade and banking. Kenya is famous for mobile money transfers. I'm sure here in the US you'd want to have that happening between your phones. I know you have banking, mobile banking, but this is money-to-money transfer. So we have Airtel Kenya, M-Pesa is our biggest, but now recently we've gotten credit transfers, where you could easily borrow a loan from your phone and transfer it to another person, and this is what we call M-sharing. So how can Kenyans, especially our health sector, tap into this for purposes of health workforce education? I think that's what I want to really talk about today and share our Kenya experience. It's a little bit of investment from IntraHealth, but it has done a lot. We in IntraHealth believe in our health workers being present, ready, connected, and safe. So I want to bring the mix between what technology, connectedness, can do to health worker readiness. What is our environment? What is our Kenyan context? It's friendly. It's allowing health worker training to be continuous. And this applies really at production stages for the pre-service, but also while they're in service. And this is through continuous professional education. So the health sector is friendly. What about technology within the health sector? Good for us, we've been able to get the Kenya National e-health strategy in place. So that's allowing technology to be applied within the health workforce training. So what have we been able to do? Over the course of time, IntraHealth has had presence within Kenya for about 30 or so years, but critically for us, I'll talk about two projects we're working with. And this is Capacity Kenya project, as well as the Funzo Kenya project. We've been working with a mid-level tertiary college, that is the Kenya Medical Training College, and within it, it has about 30 campuses with huge productions of health workers each year, about 10,000 to 12,000 health workers. But our focus has been in one place in Kenya, within the Eastern Province, and this is the Kitui campus. What have we put here? A center of excellence for family planning and reproductive health. And we have tried to look at about 6 key pillars for us. Really looking at the institution for readiness for technology, for the connectedness for the health workers. We've also looked at learning designs, administration, the delivery of learning, resources, what resources really would drive health workforce education. And last but not least, the operational support leading towards sustainability. It's good for us to bring in technology, but if the institution cannot sustain it, then it will all get lost. And this is critical for technology to work for health workforce education, especially in a developing country. For learning design, administration, to help learning delivery, we have focused on faculty development. And we have the benefit that IntraHealth has originated from the University of North Carolina. So we had a twinning arrangement put in place that resulted in expertise from here coming into Kenya and providing us with insights on how could curriculum reflect guidelines. Are they aligned? Are they misaligned? So critically for us to ensure alignment of those curricula. Next is conversion of content from the normal didactic into an e-learning environment. So the staff will also capacity build on this. The next was uploading the content on the learning management system. And this was really critical for them because at the end of the day, they will be left to manage the system themselves. Who is receiving the content? Our students. Are they satisfied? We were able to do an assessment using a Kirkpatrick's evaluation. There's been increased satisfaction. Why? The students can identify with the technology. They're the generation that has been born with a phone in the hand. So it makes it easy. They're always using it. Facebooking, Twittering. In Kenya, we have WhatsApp. So yeah, we get to connect each other on WhatsApp. So they are actually ready and ripe for it. So learning is now becoming fun for our students. They are able to accept content. That which I could not read in a book is easily available on the phone. When do I study? When I'm walking around the campus, between campus and home. This has really opened up where learning is accessible at one's own convenience. So what we've been able to do is actually ensure that the students are able to actually get that technology, the phones, some will buy the smartphones, and actually use it for themselves. The next is to couple technology with practicum experience, and this is really critical for us. So exposure through the skills lab that we've been able to equip. What about presence? How do we prepare the workforce to be present? And critically for us here is to look at the preparation of the health worker. And this is, as they move from production to onboarding, is the environment ready for them? And that is what we've been able to do, e-induction. Kenya is currently going through a county system, from centralized government to decentralization. The county health workforce needs to be prepared for the county structures. And it's critical to use a mechanism that is ready for them. We have a workforce of about 50,000 health workers. But on onboarding, we've only managed to do 2,500. And that's because we've been able to access e-learning. And I think that is critical for us. What about the supervisors? How do you prepare them to manage the workforce? What we have put in place is e-learning human resources for health modules that tackle issues of performance management, disciplinary issues, HIV at the workplace, gender in human resource management, performance assessment, and evaluation. These are critical in preparing our county governments with the under the new constitution to manage the workforce. We are suffering from huge industrial unrest at the moment, and this could be the answer to it all. Where there's no technology, no internet, and it does happen, signals disappear occasionally. We have the same content available for the health workers in a CD. I think the next step for us is actually to look at the marketing, selling of the courses. And we have actually reached out to health workers, made them aware. Their supervisors are also aware that they could be better supervisors, better managers of our frontline health workers. How do you motivate them? We have to work with the regulatory bodies, accreditation of these courses. So we have worked with the Institute of Human Resource Management, Nursing Council of Kenya, Clinical Officers Council, as well as the Kenya Medical and Practitioners Board. And through this, health workers now do get motivated because the courses are accredited and they will acquire continuous professional development points, which allows them to continue to be ready to provide health services for better health outcomes of Kenyans. But beyond the current work, what else have we done? We have looked at working with technocrats within the technology sector, the training institutions, and others who are willing to harness the current infrastructure in Kenya. And this is one of them. The one we have actually done is through the Global Health Initiative, where we have Safaricom, Intel, Medic Mobile, as well as the medical essential drugs services. How have they also helped? Technology has then applied to them. We have worked with the Ministry of Health, the Kenya Medical Laboratory and Technicians Board to bring an e-course that could help laboratory technicians have online courses and therefore be present to provide quality services from a laboratory perspective. But as we conclude, the big question I still ask, how can technology help health workforce education? I think critically for us here is to get and harness the voice of the health workers. What works for them? What helps them to be ready and present in their workplace to apply themselves in service delivery? The other is people first, technology second. Are you getting their ideas? Is it the mode that they can identify with? As I said, our youth right now who are undergoing medical education have been born with the phones in their hands. So that is the most viable mode of training delivery for them, and it is fun. But I think the other thing is really to look at the local context for technology. What's available? What's the environment like? Policy, is it present or is it absent? Is the infrastructure there? Kenya is right. Which other African country is ready for this? Or which other country in the globe is ready for this application for health workforce? Last but not least, cost effectiveness and efficiency. I think those are critical when looking at use of technology. So if we bring these spheres together, health, education, and technology, I believe we can harness it for health workforce education to ensure health workers are present, are ready skills-wise, and are tech-savvy. Thank you very much.